My name is Gaston. I'm an anesthesiologist and pain specialist from Rwanda. I want to express my gratitude to be part of this important session and this platform. As my colleagues have said, this is a highly sensitive topic and apparently less addressed in LMIC due to different reasons we might be talking about through this session. And I have always asked me a question like, do I have burnout? And I know some people have been asking that question to themselves. And I realized that the first good step to overcome burnout is to recognize it. Once recognized, it might be easy to do something. And this particular session, we'll be talking about possible solutions to implement wellness program among sub-Saharan African physicians. So this research, we can see some current research in sub-Saharan Africa. And this review highlights factors associated to burnout. Among this population, we can see unfavorable work conditions, high job demands, and low job satisfaction. And to address the issue, we definitely start by fixing this. All programs were mostly aiming to low-cost strategies, and especially individual like coping through stress management and resilience training program. But we can ask a question, is it that enough really? And should be a combination of both an individual and system. So here are some steps to the well-being. And when you look at this list and come to LMIC, especially sub-Saharan Africa, the big limitation will be is the financial capacity to make some of these steps to happen. Like when you go to physical wellness, there's a cost implication on this, peer support, and you go flexible schedules of healthcare providers, resource mobilization, and advocacy. So the case here of Rwanda, this is a graph that is showing that towards the WHO HRA target of 4.45 over 1,000 population in 2018. So you can see how we are still lagging behind to get there. Actually, that current state might take us around 185 years to reach there. But the government has got some strategies to address that. And so when you see on the graph from 2018 to 2023, this year, not much has been done in that area. And with that current trend, this will take more years to happen. So and here we can see with this new strategy that might be discussed in other sessions, or this 4x4 strategy, we just work on the workforce increase and the strategy to make sure we get to the WHO HRA target in 4 years to come. So this shows that how acknowledging that our healthcare force density is just far below the target. We expect to match to the impact of the 4x4 program strategy in Rwanda. And you can see how it needs a big effort from everyone to get there. And this is from the Department of Health Workforce Development and Ministry of Health Rwanda. So this 4x4 that we'll be discussing through the summit, it's a strategy which is approved by the cabinet on July 13th. It's here as a way to address the low health workforce density problem. And as you can see, we have challenges, but with solutions. We have internalized the training capacity and the lack of skilled trainers, which will be addressed by 4x4 reform. And then we have the motivation and retention strategies that are also another package of the ongoing reform in the health sector in Rwanda. So we'll be working on retention and motivation strategies. There's also the health workforce migration, which is actually a complex global challenge that will require a global solution as it has political and legal dimensions. So when you look at this graph and where Shapiro used this hierarchy of factors to consider developing interventions to prevent burnout, you can see when you start here at the basics, every healthcare worker should have the basics. Like here we mentioned at number one, I'm hydrated, have access to food, time to eat, I've had enough sleep, and those basics will just lead to safety. Like the staff will feel like I'm physically safe and my patients are safe, my job is secure, and then I can predict the future. And this will lead to the respect. So this mutual respect will be achieved, and like my family time is respected. I'm not hosted by the IT, and everything is like you have respect to everything. And then appreciation. I'm noticed and appreciated. I'm connected. My compensation reflects that appreciation. You have at least something that you feel you appreciate, and this will just go to the end point, which is healing patients and contribute to what we are doing. So sometimes we want to achieve to part 5, like to the top, but without even satisfying the basics. So that is the top down versus bottom up approaches. So this will show how you can't go to 5 without maximizing, at least having the maximum point of 1. So are there effective interventions? Like this is generally like individual having mindfulness exercise. There's something can be done on institutional level and health systems. So these are suggested by these studies by West et al. 2016 and Schanafeld 2017, where individual level and system level are highlighted separately. So what if we talk about like example on mindfulness exercise? This is something you can see if Africans can easily adapt. There are some courses on well-being, like some who know vast well-being courses that have been delivered in different countries, and most of they emphasize on different individual strategies to prevent and manage burnout and come back on advocacy toward the system. And here goes to stress management training, small group discussions, and peer support program. When it goes to institution, you can see enhanced working conditions, availability of equipment, and better compensation. And of course, having administrative support helps. With the health system, so duty hours policies and wellness programs. In Rwanda, we have worked on this. The health system has worked on duty hours policy, and wellness programs are in a way going. So this is the preliminary result from the ongoing study in Rwanda, and where you can see preventing burnout among perioperative providers, which was categorized like in developing coping mechanisms, like having time with family, meeting with colleagues, taking time to rest, listening to music, praying. Those are things that have been highlighted by people. Having enough sleep and exercise, and then you can go to this number two, increasing number of staff and motivating existing staff. So that's where in organization, like having teamwork, psychological support, all those things. And so having all of this in the system with the providing equipment like operating rooms, surgical and anesthesia equipment, essential drugs, and everything. So where we go to increasing, availability of equipment and supplies and drugs, and we go to increasing awareness and advocacy. So this we go with having more nurses, midwives, and other specialties, paying overtime, transportation allowance, and professional growth with this. So when you have this one, this is something that is complicated in our region, like a better remuneration where you have a salary increase, affordable houses and cars, and then, to get to good child education for healthcare providers. This suggested by this team among perioperative providers in Rwanda. So what is actually recommended? As a recommendation to improve working conditions of health workers and availability of equipment and supplies. It's sometimes and every time like it depresses, to have something, to know something to do, but you can't do that. Then you have to develop the wellness program at each institution. Implementation of robust strategy for training and retention of healthcare workers, and improving compensation and career growth for health workers. So this is the proposed way forward, because some may ask questions about how to get to that. In LMIC, and especially for Rwanda, this is what is actually needed: establishing a joint stakeholder task force, like engagement on individuals, institutions, and policymakers, and identifying budget implications and developing financial projections of this, implementing a robust monitoring and evaluation framework. So this is just like an overview of how we see solutions to burnout, solution to well-being of healthcare workers here in sub-Saharan Africa. And me talking as from Rwanda, highlighting some of the solutions could go, but sometimes not easy, but it needs engagement of everyone, from the beneficiaries to policymakers, and from going to the institution. So this is not everything, but it's just a summary of what has been discussed and from my topic. And it's time for questions and comments. So you're welcome. And thank you very much, Murakoze. This is my email for those who would reach to me after this.